Hello.
Hello.
My name's Abby. I'm going to be your nurse this evening.
Okay.
Can you tell me your name and date of birth?
Catherine Nudes, 11191.
All right. Can I check your bracelet? Perfect. Nice to meet you, Catherine. Like I said, I'm going to be your nurse today. Do you know where you're at and why you're here?
Yeah, I'm at the doctor's office for a physical.
Okay, perfect. Before you came in, they did do a health questionnaire with you,
Right.
and everything on that looked good. They also took a set of vitals. Everything was normal on that. Blood pressure was 119/75. Respirations were 16. Your heart rate was 78, and your temperature was 98.3.
Okay.
Okay. Your pulse ox was also 99, which is perfect.
Great.
All right. So let me get my hands washed, and we'll get started. Everything looks clean. Your speech sounds clear. You're hearing okay?
Yep.
All right. So what we're going to do is head-to-toe assessment, which is just what it sounds like. I'm going to assess head-to-toe, ask you a couple questions, and make sure there's nothing going on. Okay?
Yep.
So first I'm going to start with your scalp, and I'm just going to take a look in here. Have you had any dryness, itching, rashes? No. And I'm going to palpate the cranium. Are you having any tenderness?
No.
Do you have any headaches?
No.
History of migraine, anything like that?
No.
All right. I'm going to also palpate your sinuses here. Any pressure, pain?
No.
Do you have any excess drainage, anything like that? Any sinus issues?
No.
Okay. I'm going to move down to your neck. Just palpate. Cervical lymph nodes. Have you noticed any lumps, tenderness, or pain?
No.
All right, I don't notice any either. Tracheal is midline with no deviation. I'm going to feel around for your thyroid. No swelling. Everything feels good here. Okay. And now I'm going to move down your face. So I'm going to check your eyes. Okay. Have you had any vision issues, double vision, blurred vision?
No.
Okay, perfect. So first thing I'm going to do is check your pupil reactivity with this pen light. So I'm going to have you look forward, and I'm just going to put this pen light in each of your eyes just for a moment. Go. And then I'm going to have you just follow the pen light into your nose. Perfect. So your pupils were about 3 millimeters, equal, round, reactive to light with accommodation. So that's good. We're going to check your positions of gaze. So I'm going to have you follow the pen light with your eyes, but don't move your head. Okay? Perfect. Okay. All right. And then I'm just going to take a look at your eyes themselves. Sclera is white. Conjunctiva is pink. Have you had any drainage, crusting, no pain in your eyes?
No.
Okay, perfect. All right. And then your ears are symmetrical. I'm going to put pressure on the tragus here. Is that painful?
No.
When I pull up?
No.
And when I pull down?
No.
I'm going to check the extremities. Everything looks good.
Okay.
And then I'm going to check your tympanic membrane. All right. And we have it neutral position, pearly gray, oval shape. That's good. Okay. All right. And then for your nose, have you had any trouble hearing? Any trouble with your ears?
No.
Any excessive buildup?
No.
Any pain or pressure?
No.
Okay. And then for your nose, looks symmetrical. I'm just going to apply pressure to one side and have you breathe in.
Okay.
Pressure to the other side and breathe in.
Okay.
I'm going to check and look for any obstruction or blockages. Septum looks midline, no blockages.
Okay.
Have you had any stuffiness, congestion, cough, cold symptoms?
No.
Okay. bilaterally equal. And then here I'm going to have you open and close your mouth for your temporomandibular joint. Perfect. Does that have any stiffness or pain?
No.
Okay. For your mouth, can I just have you smile for me? Good symmetry. And then can I have you open up? Mucous membranes are pink and moist. Can you stick your tongue out and say ah? Good. Uvula is intact. I don't see any bleeding of the gums. Do you have that problem?
No.
And do you have any like white spots in your mouth that won't go away? Any dryness?
No.
Okay, perfect. All right, so we are going to do some range of motion.
Okay.
So can I have you push your head to this side of my hand, this side of my hand. Push back. Perfect.
Okay.
Forward.
Okay.
And up with your shoulders. Good. All right, so we are going to move down. I'm going to assess your carotid. +2, bilaterally equal. And then can you just look to the side? And I don't see any bulging or palpitations of your jugular vein, so that's good.
Okay.
I'm going to listen to your chest. And just breathe normal for me, okay? Have you had any shortness of breathing?
No.
Trouble breathing with exercise?
No.
Your lung sounds were clear in upper and lower lobes bilaterally, so that's good. Have you had a productive cough?
No.
Okay, perfect. We're going to also listen to your heart.
Okay.
I'm just going to listen at a couple points, okay?
Okay.
Start with your aortic, pulmonic, first point, tricuspid, and mitral. Okay. And then can I just have you sit forward a little bit? And I'm just going to listen for any irregularities, such as a murmur or a thrill.
Okay.
All right. Don't hear any murmurs, thrills. Your heart rate and rhythm sounds regular. And it was 78 on your vital, so that's good.
Okay.
Do you need me to sit the bed forward? I'm going to listen on your back.
Okay.
Here. And we're going to listen to the back of your lungs and the bases just to check for consolidation.
Okay.
I'm going to have you say a couple of things, and I'll tell you when, okay?
Okay.
Can you say the number 99?
99.
And again.
99.
And for ergophony, I'm going to have you say E.
E.
And again.
E.
And then can I have you whisper? And again. All right, while I'm back here, I'm just going to palpate and compress the kidneys. And tell me if you feel any pain with this.
No pain.
Okay, good. Okay, so you can lean back. And then look at your arms here. Feel lymph nodes in your arms. I don't feel any lumps. Have you noticed any lumps, tenderness, swelling?
No.
Feel pulses. Equal bilaterally, radial pulses. Equal bilaterally. Your skin is warm, no abrasions, no lesions. Have you ever noticed any cuts, wounds, stuff that won't heal, nothing like that?
No.
All right. I'm going to check your fingers here. Nail beds are clean and round. Capillary refill less than 3 seconds. Capillary refill less than 3 seconds, which is good. Okay. Can I have you turn your hands this way? This is just testing for carpal tunnel. I'm just going to apply some pressure here. Any numbness or tingling?
No.
And same thing here. Any numbness or tingling?
No.
Okay. And then one more test for that is we have you put your hands back to back, talent test. Just push them together for a little bit. Any pain, numbness, or tingling with that?
No.
Okay, perfect. For some range of motion test, I'm going to have you just put your arms out straight.
Okay.
And I'm going to have you press up against my hands.
Okay.
Good. Press down. All right, good strength bilaterally. Can you grasp my fingers for me? Good bilateral grasp. Sorry.
Sorry about that.
All right. And then I'm going to have you, can you push, bend your arm, push backwards, bend your arm, push backwards. Good. Raise your arms above your head and back down. Any pain with any of those?
No.
Okay, great. So we will move down. I'm going to try to lay this bed back for you. Bear with me a second.
Okay.
Any recent GI problems? Nausea, vomiting, diarrhea?
No.
Any change in appetite or diet?
No.
Okay. All right. So first I'm just going to look you over. Good contour, good symmetry. Umbilicus is at the midline. Listen. Abdominal artery. And then I'm going to listen to all four quadrants for vowel sounds. Active in all four vowel sounds, no hypoactivity. And then I'm going to palpate a little deeply for your liver, spleen, and kidneys. Any pain?
No.
And then any rebound tenderness when I push in and let go? Over here? I'm going to check your femoral pulses. Strong and equal bilaterally. While I have you laying back, I'm going to check your legs. I'm going to just keep moving down on my assessment here. First, I'm just going to assess the skin. Clean, intact, no abrasions. Check your heels. No ulcers, nothing. Pretibial edema. Feels good. No swelling, no pitting, edema. Popliteal arteries. +2 bilaterally. Anterior tibial. +2 bilaterally. And dorsalis pubis. +2 bilateral. Very good. All right, and we're going to do some range of motion with your legs. First, I'm going to lift up and bend. Good. Any pain with that? In your hips, groin?
No.
All right, and then straight up. Good. Straight and up. Good. And then I'm going to put both my hands here. Lift your feet up. Perfect. I'm going to come down here. Push against my hands. Push against my hands. And roll your ankles. Any pain with any of those motions? Have you had any numbness, tingling in your legs?
No.
Any weakness bilaterally?
No.
Any calf pain?
No.
Unilaterally. Okay. So we're going to move on to neurologic. part of the exam. First thing I'm going to do is test a couple reflexes.
Okay.
So I'm going to have you hold your arm out, test your brachial. Just going to use this part of my stethoscope.
Sure.
Good. Good. And then this one is going to be your patellar. Good. And then your Achilles. And your Babinski, I'm going to go on the bottom of your foot and around. Good. All right. And your toes open and fanned up bilaterally, so that's perfect. All right. So I'm going to have you. I have this pencil. There's a sharp side and a soft side with the eraser. I'm going to have you close your eyes and just tell me which side of the pencil I'm using on your arm.
Soft. Point. Soft. Point.
Perfect. All right. And then another test we do, I'm going to have you hold your hand out, close your eyes, and just tell me the object that's being placed in your hand.
A pencil.
Perfect. And then for graphics easy, I'm going to open your hand and I'm going to write something in there and just tell me what I'm writing.
An 8.
Perfect. Okay. Alrighty. Okay, can I have you take your left hand and bring it to your nose? Perfect. And your right hand and bring it to your nose? Perfect. And then I'm going to have you take your left hand, cover your left eye, and I'm going to use my fingers, and you just tell me what numbers you see.
2. 2. 2.
Perfect. And can you cover your right hand with your right eye?
2. 2. 2.
Perfect. All right. Have you had any memory loss, seizures, any episodes of syncope or passing out?
No.
Okay, great. All right, so I'm going to lower your bed.
Okay.
All right, and we're going to move on to the musculoskeletal part. So first, have you had any muscle, joint stiffness, pain?
No.
Any issues, arthritis, history of anything like that?
No.
Okay, great. So I'm going to have you, you can put your legs out and get out of the bed for me.
Okay.
And I'm going to have you just walk to one side of the room and then walk back heel to toe.
Okay.
And then can I have you tiptoe down and walk on your heels back? Good. And then we're going to do a Romberg's test. So I'm going to push you side to side, forward and back very gently, and just try to keep your balance for me. Good. And then we're going to assess your spine for scoliosis. I'm going to have you bend over. Good. All right, your spine seems straight. Any pain with that motion?
No.
Okay. And then I'm going to have you, using the bed, I'm going to lift it up a little bit. And I'm just going to have you put your hands on the bed and take one leg and bend. And next, one leg and bend. Good. All right. I think that is everything I need from you. Lower the bed and you can hop back in. Do you have any questions for me, issues, concerns, pain?
No.
Nope. Okay. So I will let the doctor know that everything was good. I'll get this information put in. If you have any questions, if you need anything, again, my name's Abby. Please just let me know.
Thank you.
All right. Thank you.